Hello, and welcome to the Natural PCOS podcast, the podcast dedicated to empowering women with polycystic ovarian syndrome through natural approaches. I'm your host, Dr. Samina Mitha, a naturopathic doctor with a passion for women's health and hormones. Each episode, I'll explore the latest insights and my personal experience to help you manage your PCOS naturally. Together, we'll dive into practical tips, inspiring stories, and the latest research to support your journey towards balance and wellness. Let's get started on your path to thriving with PCOS naturally. Hello, everyone, and welcome back to the Natural PCOS podcast. I'm Dr. Samina Mitha, naturopathic doctor, and today we're talking about fertility and PCOS. When I thought about this episode, the title that came to my mind was, Will I ever be a mom? I think this is a common question that comes up in women when they get first diagnosed with PCOS, because that's the conversation that is being had is, if you ever need any help with trying to conceive, there's always medication. I know that was my story or the conversation that I had with my doctor when I was initially diagnosed at the age of 19, around that time. And for me, this was like a big, deal. Somebody's telling me that I'm going to need medication to get pregnant one day. And that really, took a lot out of me because I always just assumed that I wouldn't have any troubles getting pregnant. And I think the other thing to say about this is, you as a woman, you know that this is what your body is supposed to do. And this is natural for your body to actually do this process, is getting pregnant and having a child, and then having to be told that, you have this condition that maybe could potentially cause you to have troubles, maybe never even have a child or need extra support through medication. I just felt like when I was told that at the age of 19, that was a big deal for me, and I was going to do everything I could possibly do to try to get pregnant naturally, or just figure out how to support my body so that it could potentially, if it wanted to, get pregnant naturally. Now, I'll go into my story in a second, but I think one of the biggest things when it comes to PCOS is this notion that every single person who has PCOS is going to have troubles getting pregnant. And this is not the case. A lot of the patients that I see, some of them get pregnant naturally, and some of them do need medication and support. In my journey, when I was first diagnosed, I then, took a step back. I actually got diagnosed through a naturopathic doctor and my medical doctor together. My naturopathic doctor actually had this inkling that I had PCOS. So then that's when I went to get an ultrasound and blood work. And this is when it all came together, and it made sense. Like, I was having really bad cystic acne. That was the biggest one. I think my cycles were pretty regular at that point. And then, I was given birth control pills because that was going to help my acne. It did, but it made everything else worse for me. Specifically, I was nauseous. I became depressed. I came off the birth control pill, and then I just went into another pill, escitalopram, to help with anxiety and depression. And that was really tough to go through. But I think at the end of the day, I did a lot of work with my body to help it to heal naturally. I did end up coming off escitalopram. I really balanced my blood sugar. When I went to naturopathic school, this is when I really changed the way I was eating. I kind of switched towards like a Paleolithic type of way of eating lots of complex carbohydrates, more vegetables than I probably have ever eaten before, reducing all the sugar in my body to help heal and remove any of the candida in my gut. And this is when I actually started to heal. I worked on my stress, my anxiety, my nervous system, because DHAS was really high in my case. And I found that balancing blood sugar, working on my stress, was a key to actually regulating my cycles. Many people actually ask, is there anything I can do to help support my body so that when I do want to get pregnant, I won't have any troubles? I think one of the biggest answers to that question is making sure you're actually ovulating. Like, are you getting a period every month? What does your body look like in terms of just the amount of weight that you're carrying? What's your lifestyle look like? Are you eating well? Are you moving your body? Are you staying hydrated? Are you working on your stress? Are you sleeping well? All these things are really going to impact your ability to get pregnant one day when you do want to get pregnant. And so if you work on those lifestyle pieces now, by the time you want to get pregnant, you will, be already 70% there probably with all the lifestyle pieces. One thing I do want to go back to is kind of my story of fertility. So then when I went to naturopathic school, I came out, I ended up getting married. And then a few years later, we started to try and it didn't really work. I realized I wasn't ovulating. So I actually did end up going to a fertility clinic. We did a few rounds of letrozole, didn't work. They found out I had a polyp, so I had to get a polyp removed. And this was during COVID time. So it was really difficult to even get in for a surgery. But anyways, it happened. I removed the uterine polyp. And then at that point, waited a little bit longer, did a few other rounds with, I think, 2 rounds of gonal F. And then the third round, gonal F with an IUI, actually worked. And it was great because this was right before I was just about to do an IVF cycle. So, at the end of the day, ultimately, I did have to use medication. This was something really hard that I had to deal with in terms of coming to terms with that my body couldn't naturally do this on its own and it needed help and support. And actually this year, so now my daughter's 3, but this year I actually had a little bit more insight as to, why I was even struggling even more, because a lot of times when I was helping patients to get pregnant, they were getting pregnant. These PCOS women were getting pregnant. I kept being like, why am I not getting pregnant? Why are all these women that I'm helping getting pregnant? And I'm trying to help myself. I had a naturopath as well. I had many naturopaths, actually, friends, colleagues helping me, supporting me along the way. And I wasn't getting pregnant. And I was really frustrated with my body and myself. And I thought it was all me. But I actually ended up finding out that I have endometriosis as well this year. And that was a big awakening moment for me too. Like, okay, my body was struggling more than I actually thought it was. And it just needed some extra support. And that's okay. It's okay if you need that extra support sometimes. Anyway, so I have this beautiful 3-year-old daughter, and she's great. And I'm so grateful to have her in my life. And I think that, that journey really pushed me to be resilient, to be kind to my body, and to, still do all the things for naturopathic medicine. I think that really helped me to prevent having to do an IVF, I guess, because I was doing everything: osteopathy, botanical medicine, acupuncture, taking my supplements, moving my body, working on my stress. I was trying everything, almost too many things. Because when I kind of gave it all up, like, okay, I gave up a few things just to help like bring the stress down. That's when, I ended up getting pregnant. One of the biggest things I can tell you that has helped a lot of my patients is bioidentical progesterone, using this to regulate cycles. I had a few patients, like 2 patients actually in the last 2 weeks, have reported that they've actually haven't been back to my clinic because their cycles have been really regular after, maybe a year-long course of progesterone. So when we cycle bioidentical progesterone, it actually helps us to ovulate, and then eventually you can come off, and it should actually help your body to ovulate continuously, month over month. And these patients have noticed that, and it's really cool. I think that's one way, if you're wanting to conceive in the next, 2, 3, 5 years, and your cycles are really irregular, getting the cycle regular is really important. One of the ways we do that is with bioidentical progesterone. Another way is actually treating insulin resistance. If we can treat the insulin resistance, maybe through myoinositol, the way you're eating, the way you're moving, that can also help those ovaries to actually ovulate. I think another thing that's really important is getting testing and an ultrasound, even yearly if you can, because that will just give you information every year as to what's going on with those ovaries. Are the cysts staying the same? Is there no cysts anymore? Have you had more cysts? What does your AMH look like? AMH is anti-Mullerian hormone. This is a hormone that gets produced by the follicles that are left over in the ovaries. Your AMH is a good, telltale sign of your ovarian reserve. Typically, women with PCOS have a higher level of AMH, which is a good thing. But also, if you have too many follicles too, the way that they actually grow together to get one to ovulate every month, by the way, a follicle houses an egg. So you come with about 10 follicles on each side every month. And with PCOS, we often see way more than 10. And sometimes when we see too many, it's hard for that cohort to grow together nicely and then get that one big nice follicle to ovulate out. So just supporting that growth, especially in that first half of the cycle, is important. By balancing the hormones, we can do that. Balancing insulin, testosterone, estrogen, progesterone, that can help with building the best quality follicle that we can get. And I think that this is also something that you should consider, is that women with PCOS, they may not be regularly ovulating every month, but maybe they're ovulating 9 times out of the year. And so their chances are a little bit lower than somebody's ovulating, every month. They're going to have 12 chances in that year. So just think about it that way. A lot of times we're being told that wait 12 months and then seek out fertility care. Sometimes, depending on your age, I know it can be different if you're a little bit older, but give yourself 12 ovulatory cycles to actually then consider fertility treatments if you have the time, based on your age, because that means you've tried, in 12 cycles that you're actually ovulated in. And then also keep in mind that learning how to track ovulation is really important before you start to conceive. You don't want to get to the point where you're like, yeah, I'm ready to conceive, and then you don't know how to track how you're ovulating. So, using something like a wearable band, using something like LH ovulation strips can also help, but they can be inaccurate in women with PCOS because sometimes we do see that LH can ride high throughout the whole cycle. But what you can do is just do it in a whole month and see what happens for yourself, because not all women are like that when it comes to PCOS. We do find that some women actually get this nice LH surge and then it comes down, and then we know that the patient has ovulated. So just keep that in mind as well. Track your ovulation. If you have insulin resistance, work on that. If you need extra support, seek out a practitioner that can prescribe bioidentical progesterone to help you to ovulate. All of these things can actually really help you and get you set up to when you do want to actually finally take the plunge and try to conceive. I hope this episode was really helpful. If you have any questions at all, please send me a message and I'll see you in the next episode. Bye, everyone. Thank you for tuning in to the Natural PCOS podcast. I hope you found today's episode insightful and empowering. Remember, managing PCOS is a journey and you're not alone. For resources, tips, and to connect with our community, visit my website at saminamitha.com. You can also find me on Instagram at dr.saminamitha.nd. If you enjoyed this episode, please subscribe, rate, and leave a review. Your feedback helps me to reach more women seeking support for PCOS. Until next time, take care and stay well.